We're so glad you're with us today. Most everyone knows about the dangers of secondhand smoke, but harm may still occur long after the cigarettes are extinguished.
Something you really don't think about. Angela Brumley Shelton is joining us today from the Lexington Fayette County Health Department to tell us about the dangers of third-hand smoke and how to avoid it. Thanks for coming.
Thank you.
Third-hand smoke, what do we mean by that?
When we say third-hand smoke, we are referring to the residue that's left behind in an area where someone has smoked. And that includes any tobacco product, but now we're also referring to where someone has used an e-cigarette or vaped.
So when we hear of cases of, say, lung cancer where someone never smoked, sometimes the link is to someone who did, right?
Well, it's not quite that strong yet,
Okay.
but we do know that there's a link between secondhand smoke exposure and to certainly cases of lung cancer. But right now we're trying to really concentrate on the third-hand smoke, which is what we find the residue, especially as it harms children.
Well, what do parents need to keep in mind? Maybe they don't smoke, but their children could still be exposed to this. What do they need to do?
Well, there's kind of two things that we're looking at. First of all, that we're trying to concentrate on with our project this year. If you smoke, obviously the best thing that you can do is to stop. But if you're not ready to do that or you can't do that, then we're asking or encouraging you to smoke outside. And not only to smoke outside, but also to make sure that before you come in that you wear different clothes and that you wash your hands before you're around your children. The other thing that we're working on the project this year is that in childcare, that a lot of parents, maybe if no one smokes in their home, they don't realize that their child could still be exposed to third-hand smoke by people who care for the children. And so what we're asking parents to really think about is to ask their child care center director, is this a 100% smoke-free center?
Yeah, because you're very careful to say where the links are and where we aren't quite with the science
Absolutely.
at this point. But, I mean, are we potentially talking about surfaces like a sofa, carpets, that kind of thing as well?
It is. You have to remember that there's 7,000 chemicals in a cigarette, 7,000 and counting. And we know that a great many of them cause cancer. They're carcinogenic. But when a cigarette's smoked, those chemicals don't go away. They go into the air and they volatilize, meaning that they mix with the air and the dust and they settle down. And they create, especially the one we worry about is nitrous acid. And then you have to think about, where do kids spend most of their time? Crawling on the floor, they put their hands in their mouth. And anytime someone smokes, the secondhand smoke gets and the third-hand smoke gets in their clothes, their hair, everywhere. And especially if the child care or someone who works in child care is picking up a baby, they're going to expose that child to those chemicals.
Very important things to consider. Thank you very much for coming in.